2020 global coronavirus pandemic is a defining moment in history, grinding 21st century life to a standstill and causing pain, suffering and death to thousands. These are the scenes in hospitals around the world. And yet, as unfamiliar as all this is to us, today's images are similar to these. This was 100 years ago during the 1918 to 1920 Spanish flu. That deadly influenza is thought to have infected between a quarter and a third of the world's population at the time. And the global death toll is still disputed to this day, with it ranging from 17 million dead to 50 million to even 100 million deaths worldwide. So what exactly was the Spanish flu, and why was it so deadly? And how did that pandemic change the world 100 years ago? And can it tell us anything about our response to coronavirus today? Where did the Spanish flu come from? The origins of this particularly deadly strain of the flu is disputed. The common theory is that it began in the United States in March 1918 among soldiers at Fort Riley in Kansas. Those men were preparing for deployment to the Western Front, thus transporting the flu from North America to Europe during World War I. The other theory is that it came directly from the trenches on the Western Front, when soldiers on both sides began suffering from a novel type of influenza. Either way, it spread quickly among soldiers in Europe and eventually further afield. But why Spanish flu, given that whatever its origins, it did not start in Spain? While countries fighting in the war had strict censorship of the press, and news of a lethal flu was suppressed because it might affect a nation's morale. But when the flu spread to Spain, well, they were a neutral country during the war, and there was no press censorship around the flu outbreak. In fact, authorities there thought they were the only European nation battling this influenza, hence it became known as the Spanish flu. A second, more deadly wave struck in August 1918, hitting the ports of Freetown in Sierra Leone, Brest in France, and Boston in the United States, and it then spread across the world.
On an unprecedented scale, during World War I, young men are on the move in cramped, overcrowded conditions, which is an absolute dream for influenza virus to spread. And so on those overcrowded troop ships, on troop trains, in prisoner of war camps, it spreads very rapidly indeed.
But what were the symptoms? It would initially be like normal flu, shortness of breath, sore muscles, high fever, headaches, and then it would progress.
They would begin to have hemorrhaging in their lungs, an edema in the lungs, so their lungs would begin to fill with their own bodily fluids, which would mean that literally people would be kind of drowning in their own fluids.
The Spanish flu was different to today's coronavirus. For example, it killed a large number of healthy adults between 18 and 44 years old. That seems to follow a very different pattern to the coronavirus outbreak today, where elderly people are at greater risk of complications from the disease. And this all took place in the aftermath of a world ravaged by global war, a particularly devastating time for a pandemic to strike. And remember, back then they had no pharmaceutical interventions and had not even begun any notion of a vaccine, given they didn't even know it was a virus. Today we are so much more advanced, and the help of ventilators and other treatments are helping us to treat people and save countless lives. Much of the spread of the Spanish flu was down to the movement of people after the war, and we can see differences in how countries were affected by the way they dealt with arriving ships. Take the example of two islands, Western Samoa and American Samoa.
Western Samoa out in the Pacific is infected by a New Zealand ship. It undergoes probably the worst experience of Spanish flu around the globe. About 25% of the population of Western Samoa died in the Spanish flu.
40 miles to the east, in American Samoa, they imposed a strict 5-day quarantine for all boats that had influenza. They reported no deaths. Over in the United States, 675,000 people died from the Spanish flu. But again, there were differences in some cities. In Milwaukee in Wisconsin, the death rate was just under 300 per 100,000 people. In Philadelphia, Pennsylvania, it was more than double. What was the reason for this disparity? Well, Milwaukee was ahead of the curve, guided by a health commissioner who very early on launched a campaign of posters and adverts calling on people to avoid crowds and transport.
They did early social distancing. They closed saloons and public gatherings. They closed down the schools and churches. They asked people to stay away from one another.
On the other hand, in Philadelphia, they didn't move as quickly, and held a huge Liberty Loan Parade in late September that prompted a huge outbreak.
Suddenly, the healthcare system is completely overwhelmed. Everything from nurses and doctors all the way through to those who could dig graves, those who could build caskets, are simply overwhelmed, and people are frankly unable to give to the sick, the dying, and the dead the kind of respect that they really deserved.
And a 2020 paper from researchers at the Federal Reserve and MIT found that those US cities that had strict interventions for longer also saw a better economic recovery. Given that the Spanish flu killed so many working-age adults, if a city managed to limit the number of deaths, the more people there were to go back to work once the lockdowns ended. But what about after the peak of the pandemic? Well, in Australia, the country managed to avoid the second wave of the Spanish flu, but they did not avoid it completely.
And they put in place maritime quarantine in the latter half of 1918 and managed to keep out the most vicious wave of the pandemic. But unfortunately, they lifted that quarantine too early in 1919 and let in the third wave. And 12,000 Australians died in that wave.
In the longer term, doctors and scientists realised that they had got the flu very wrong and needed to expand their knowledge. Remember, back then, many thought influenza was caused by bacteria rather than it being caused by a virus. After 1918, there was more of a focus from the scientific community to be better prepared in the future.
Starting from the 1920s is that virology takes off as a field, the study of viruses. Also epidemiology, which is the study of patterns and causes and effect.
And given that many countries struggled to cope with the pandemic, there was also a desire to have a better global response. And thus 1918 began a process which saw the creation of the World Health Organization.
We created the first global health agencies after that pandemic because we understood the need to coordinate an international response. The WHO is the descendant of that. And unfortunately, we've moved away from the understanding of the necessity of that kind of agency.
It's very easy, with the benefit of hindsight, to say what worked and what didn't work during the Spanish flu, and say that what worked then might be able to work now. As I speak, we cannot be 100% sure what is and what is not working. For example, many are now questioning whether we can rely on the data out of China. We're still assessing, evaluating, and understanding the exact nature of the coronavirus and what works to stop its spread. But there are some other similarities with the Spanish flu, starting with the name. The fact that it was, and still is, labelled the Spanish flu shows how people and countries often look to blame someone for such an outbreak. That blame game is being repeated again today.
Why do you keep calling this the Chinese virus? There are reports of dozens of incidents of bias against Chinese Americans in this country. Why do you keep using this? A lot of people say it's racist.
It's not racist at all, no, not at all. It comes from China.
In the face of the threat that an epidemic poses to life, an almost natural human response is to say, who's to blame? Who's responsible? It's them.
And that also feeds off misinformation or fake news, something that was prevalent 100 years ago and is happening now. Back then, there was fake news and fake remedies, the idea that alcohol would protect you, and special elixirs were sold to people who thought they would be safe. So too today, fake remedies are being offered, as well as conspiracies. In the UK, arson attacks have taken place on telephone masts because people believe the completely false theory that the new 5G network is spreading coronavirus.
Large numbers of people who don't pay to get their news, get it from social media sites or other, are not necessarily getting good sources of information. So I think that's an old problem that has a very modern twist on it.
Furthermore, many public health experts have warned us for years that we have not been preparing for a pandemic, even though recent examples of SARS or MERS have shown that outbreaks can happen again.
People have been urging us in our local communities to think carefully about how we will be ready for the next big emergency, and many of us have not taken them seriously enough.
Perhaps this outbreak may change how countries respond to pandemics in the future. Because let's not forget one key similarity between the Spanish flu and today: the emotional toll this will have.
When a man said to me, I was 10 in 1918 when my mother died. And this was in 1998, so he was a man well into his 80s. I was 10 when my mother died in 1918, and I have missed her ever since. How do you say that that's not a life-changing experience?
2020, like 100 years ago, will have a huge psychological effect, not just on those who have lost jobs, who are struggling for money, or who are living apart from their family, but the countless lives lost around the world, of the devastating stories of people not being able to attend their loved one's funeral, of the doctors and nurses that have died trying to save lives. Just like with the Spanish flu, this is a profound moment in history, but we cannot let it simply pass into history books. We must remember what we have learnt and remember those we have lost.